Hello friends, I am Dr Sadeep. In my channel I will be uploading videos concerning practical applications of homeopathy, how to practice homeopathy in the classical way. So in this series I have already done so many videos. If you are interested in these type of subjects, please like, share and subscribe our channel. And today's topic is very important, friends, because there are so many homeopathic doctors who practice homeopathy in a classical way, they claim. But unfortunately, there are two dimensions in homeopathy wherein there are so many people who are neglecting or who are not focusing on the point. So, whenever you choose a medicine for an individualistic patient, there are possibilities open to suppress and to cure. So, there is a very fine line between two things, that is cure and suppression. So, you must be very keen in observing the patient, and you must be very keen in following up the case, in which direction the case is going. Because if you choose any medicine, there are only two possibilities, friends. One is suppression, that is palliative suppression, if you can call as, or there is possibility of cure. So homeopathy has always open to two dimensions of treatment. So in homeopathy, all think that there is only possibility in homeopathy is cure. No, it is not like that, friends. Simply because we have 100 and 1000 of medicines which can suppress more diseases than any other system, simply because we are using our dynamic medicines on the human being. Due to that reason, there is possibility of suppression of the diseases, and there is possibility of cure also. But the homeopathic physician must be very keen in observing what the thing is happening in the each individual patient. So there are two dimensions whenever you give the homeopathic indicated medicine to each individual patient. So in which direction the cure will happen, in which direction the suppression will happen, there is a very fine line between these two, friends. So the proper understanding of prognosis is one of the important thing in homeopathy. So if you are very keen observer, if you are a classical homeopath, if you are interested in curing the patient properly, even a slightest change in his health or in his disease must be taken note of, and in which direction the disease is prognosing, in which direction the patient is going, is very important. So if you want to have a proper guidelines, if you want to understand in which direction the patient is prognosing, then you must have a thorough knowledge of miasms, thorough knowledge of embryology, thorough knowledge of genetical makeup, thorough knowledge of total disease process and disease prognosis. So if you have all the proper knowledge what I talked of, then it will be very easy to pinpoint the patient's direction of prognosis. Is it deteriorating? Is it prognosing in a right direction? So homeopathic physician will be very happy once the symptoms are totally taken care. That is, if he is able to take out the symptoms from the patients, he will be very happy. It is not our goal, friends. Taking out the symptoms is a very mean mindset of a physician. Simply because with any powerful medicine, with any material dose, this can be achieved just in few minutes. But it is a crime to do that simply because we are in a position to cure, we are in a position to do more better to the humanity. Due to that reason, a homeopathic physician is a very responsible person in the society. Due to that reason, all homeopaths should struggle, should put their total energy to become a master homeopath. Master homeopath never suppresses any of the diseases simply because he has a proper knowledge of the disease, proper prognostic guidelines what to be followed, and he will be keenly observing each and every patient after giving any of his medicines. How he is behaving, how his symptomatic presentation is presenting, what are the criteria to be used to evaluate the prognosis, in which direction the prognosis is happening, in which direction the patient is moving. Is it in a suppressive direction? Is it in a curative direction? So this becomes a very important topic for each and individual homeopathic doctor, because it is our responsibility to cure the patient. Unfortunately, many homeopaths practice suppression therapies. They are very happy by just annihilating the disease. But once you suppress the disease will come in a different form, different set of symptoms, different modalities. Due to that reason, homeopathic physician must be very keen observer, and he must be very thorough in understanding of the diseases, disease mechanisms, prognostic criteria. So this is all about this suppression of homeopathic medicines and curative effect of homeopathic medicines. Which you want to choose is dependent on the intelligence of the homeopathic physician whom you are going to. Due to this reason, I just made this video, friends. There are always two dimensions whenever you give a medicine for any of the homeopathic patient, any of your patient. But a keen, intelligent homeopathic physician will always observe a mild change in his patient, and he will not try to suppress the disease. He will try to annihilate the disease from its roots. And this is the only way we have in our homeopathy. But unfortunately, we have some medicines which also suppress. So due to that reason, you must be very keen in observing, keen in taking note of in which direction the patient is prognosing. So this is all today, friends. If you like this video, please like, share and subscribe our channel, and in future also I will be doing such videos. If you have any doubts, please put in the comment section. I will be talking about those subjects also. This is all today, friends. Thank you and take care.